Baby poop starts as black, which we call meconium, and then subsequently changes to green and yellow and usually seedy and grainy. And usually, congratulations, moms, dads, grannies, or any one of you who is celebrating a little bundle of joy. This is your baby week 1. I am Dr. Nkirika. I'm a pediatrician, an ER doctor, and a mom of 3. This whole series is going to be about your baby week by week. And this is born out of my concern of the little ones I see in the ER with their families with things they think might be normal and might not be. We know that every baby is going to be different, but in this whole series, I'm going to give you a guide of what to expect from your baby week by week and subsequently month by month, so that way you can calm all the nerves, know what to expect, and know when to seek care in the emergency department or with your regular pediatrician. Your baby's first week, the 4 main things to expect from them are sleeping, feeding, peeing, and pooping. Your baby is going to be sleeping a lot this first week. Most babies sleep between 18 to 20 hours within their first week, and that's usually completely normal. They are probably not used to being outside yet, or they might just be exhausted from the whole delivery process as well. This might be different for different babies, but most of them are going to be awake enough to feed, and some of them may even wake up intermittently in the middle of the night. But on average, they may be awake between 3 to 4 hours just to get their feed in. If you notice your baby struggling to sleep or getting a little bit fussy, this is also the time period where swaddling, rocking, and a little bit of white noise still stimulates the environment in pregnancy. And by doing all that, you might be able to make them comfortable enough for them to sleep. Whether you're breastfeeding, formula feeding, or both, anyone you decide to choose is great. Remember, fed baby is the best baby. Initiating breastfeeding might be a little bit of a struggle. And if you are like me who got engorged in the first couple of days, it might feel like the worst feeling ever. There's the pain, the overwhelm. And please remember, you can seek care with a lactation consultant if you have access to one. In my case at the time, pain medication, massages, showers, cabbage leaves, and some cool packs, as well as expressing and feeding, even though I was in pain, usually helped give me some relief intermittently. Within the first couple of days and first week of birth, you may not be making enough breast milk. If you're breastfeeding, you may just making a small amount and making colostrum, and that may make you feel like you're not making enough. In that first couple of days and week, your baby might be satisfied with just 1 spoon, and usually they don't need a lot to feed at that time. So you don't need to aim for large ounces. Within the first week, between 1 to 1.5 ounces of either breast milk or formula is actually enough to satisfy them. And if you feed them more, they may get distended and more uncomfortable if they're overfed. If you were doing a mix of both breast and formula, you may want to get an idea of how much you're making from the breast first before you give the formula. For instance, you may decide to express. If you get in about 1 ounce or 1.5 ounces of breast milk, then you may not necessarily need to top it again with formula, and you may leave formula for the next feed. During the first week as well, babies tend to feed more often because they have smaller stomachs, so it's not uncommon for them to feed every 2 to 3 hours. Even some may go like every hour because they have smaller stomach and tend to get full easily. And then now to the diapers, both wet and the poopy diapers. Every baby is going to be different, but on average, babies poop a whole lot more within the first couple of days and week of birth. Baby poop starts as black, which we call meconium, and then subsequently changes to green and yellow and usually seedy and grainy, and usually comes a lot. Baby poop within the first week can be small squirts or like significant amount, or you can have blowouts that sticks out completely all through different sides of the clothing. While baby poop can look like different colors from black to green and yellow, 2 main colors we generally do not want to see, or we always recommend to get checked out, are white, which may signify liver problem, and then red, which may mean your child might be bleeding from somewhere, and they both need evaluation. And for wet diapers, your baby might have between 5 to 8 wet diapers a day. During that first week, you may not necessarily get a really heavy diaper, but you want it to be stained. You want to make sure that the lines, which is the lines of the diaper, changes color. And because babies are not feeding a lot, they're not having a huge intake, you may not necessarily get that heavy, chunky diaper they get when they grow as they get older, but you should get some small diapers that are wet at least between 5 to 8. The wet diapers and the poopy diapers are an easy way to monitor how much your baby is feeding. So if you're noticing your baby is not waking up to feed, sleeping too much, and then you're noticing a decline in diapers, you're getting only 1 or 2, I want you to please call your regular pediatrician and get them checked out, or maybe come into the ER because you're showing us signs of maybe concerns for dehydration and a baby who's not very interested in feeding. The other thing that may happen within the first week for your baby is jaundice. Many normal, healthy healthy newborns may have jaundice. Jaundice is when they have this yellowish tinge on the skin and the eyes because there's a buildup of a chemical in the body called bilirubin, which is usually broken down and eliminated by the liver. But because the baby is still developing and the liver is not completely mature enough to get rid of all the bilirubin, it may show on the skin and the eyes as yellowish, which is what we call jaundice. Jaundice may be due to breastfeeding jaundice, which means you may not be making enough for the baby and they're getting slightly dehydrated, or breast milk jaundice, or it may even be due to your blood and your baby's blood not being compatible and their cells are breaking down more and making more bilirubin. So this is not something I want you to worry about. A lot of babies are checked for jaundice and their bilirubin level before they are discharged from the hospital. So this is something your provider or the birthplace you have usually will let you know if your child has jaundice even before you get discharged home. If your baby has jaundice, most babies are able to go home with a little sunlight and feeding. Their body is able to take care of all the chemical and bilirubin which is being made, and they need nothing else. Some other babies, like two of mine, and they were two boys, ended up being in the hospital and needing a special light called phototherapy. This special light helps break down the bilirubin into something better and something your body can handle and be able to pee it out in their urine. And in those scenarios, when the level is at a spot where their bodies can handle, they're usually sent home. If you were told your baby had jaundice and they were discharged home, I want you to keep an eye on their skin color, their eye color, their poop color to make sure it's not white, and also their urine color in general, how they are feeding. Babies who are diagnosed with jaundice are usually seen by their regular pediatrician or the urgent care ER for another recheck within 2 to 3 days to make sure that the levels are coming down nicely, not trending up. In week 1, there are also some weird but normal thing that your baby might do. Number 1, your little one, especially your little girl, may have a mini period called the false menses, and that's when you see some blood in their diaper area and it seems like they menstruated. Number 2, you might see some orange crystals in their diaper. That usually suggests that they might be a little bit dehydrated and they need a little bit more feeding. That's something I want to check with your regular doctor, but it's not common for you to see those orange crystals in their diapers. And now let's talk about you. We've talked about baby, what to expect, and things that might be normal and what might not. But what about you? Moms and dad and caregivers who are actually taking care of the baby. This week can also be very overwhelming to you. How are you feeling? You might be excited you can now finally sleep on your belly because you're no longer pregnant, but you may not necessarily be getting enough sleep. I can't tell you to sleep when your baby is sleeping because it is actually very hard to do. Knowing feeling well, you might be overwhelmed and have a lot of things you're trying to plan. But I want you to remember to coordinate. I want you to remember to rest. I want you to remember to ask for help and support, because when you're feeling better and stronger and happier, your baby is also going to be feeling the same. So don't forget about you. You can skip a few dishes to get some rest. You can skip bathing your baby to get some rest. And don't forget to ask for help from your family or friends and those who are actually around you. I was team do it myself initially, and it did not do me any good. And I realized that asking for help actually made me feel better and actually made me get the support that I need. So don't forget to ask for help. And finally, as an ER doctor, I just had to plug this in. Here are things that I want you to watch out for within that first week that should get your child seen in the ER immediately. I am hoping that none of you need to do this, but I want you to know about it just in case. Number 1 is fever. Every newborn with a fever is a high concern for infection. And because their immune system is not well developed, we always want to see them immediately. So if your baby has a fever, I want you to take them to the nearest emergency room so they can get a full evaluation and the care that they need. Number 2, excessive sleepiness. I know this might be more difficult to differentiate which one is which because babies sleep like a long time during that first week. But if your baby is not waking up to feed, your baby is not interested in feeding when you try, and they're sleeping excessively, I think you want to get them evaluated. Yes, it might be normal for them to sleep, but then also within that first week, there are also some chemical disturbances, metabolic disorders that may manifest as excessive sleeping that we always want to get evaluated. Number 3, prolonged abnormal breathing patterns. I did a completely different video about how normal babies breathe or normal newborns breathe, but when you're noticing prolonged pauses or prolonged periods where they're breathing faster, that's not completely normal. We always want to get that checked out as well. And of course, finally, anything else that you see is off. We always have our parental guts. If you think there's something that does not seem right or something that you're not sure about, you can start with your regular pediatrician. But also, we are always in the ER 24/7, and we're able to see and take care of your baby and make sure you're comfortable going home or giving them whatever care that they need. So this is an abridged version of what can happen in your whole child's 1 week of life. And I know, of course, I missed a whole lot of things, but I would like to hear from you. How is your baby's first week, or how is your baby's first week going? What questions you have about the first week? What are some scares you may have? I'd like to hear that. Let me know in the comments. Also, I will be dropping week 2 shortly, and I want to hear from you and know what that sounds like.